please subscribe to my channel. We'll be putting out a lot more videos in the future. And if you have any ideas or comments in regards to what you'd love to watch, I'd love to hear from you. Hey, your pee looks good. This is a phrase you want to hear as you're leaving the office. Today I'm going to walk you through the process, so let's go to the lab and take a look. We're going to be discussing what constitutes a good urine specimen. We're going to look at what the provider's looking at when they're looking at your sample, which would be the amount and clarity, and we'll go through those components of what actually is in the urinalysis, like the glucose, the ketones, your specific gravity, blood, pH, protein, nitrites, and leukocytes. All 8 of those components are what are important when viewing a urinalysis. We have examples here of 3 types of urine specimens. And the first urine specimen, the patient is an overachiever. So she filled up her urine a little bit too high, and you can tell though that she is very well hydrated, so I give her A+ for that. The second specimen, it looks like maybe possibly this poor lady has a urinary tract infection. It almost looks visibly like we have some blood in the urine, and it's a very small amount. And sometimes with urinary tract infections, you're peeing frequently and it's burning when you pee, and it looks a little blood tinged. This is actually a little concentrated, but it is the right amount, and you can see like there's good clarity. So we're not only looking at how much urine, we can look at how clear the urine is, the color of the urine, and if it has an odor to it. So it seems a little odd, but yes, actually urine can pick up odors from your foods that you eat. So sometimes if you're eating a lot of garlic or onion based foods, we can smell that in your urine. Sometimes medicines will also come through. We can tell if you're taking your prenatal vitamin because it almost has a fluorescent yellow color to it. And we also can smell if you have a urinary tract infection with the specific E. coli bacteria, because that has a pungent odor to it all to its own. We use the urine dipsticks to determine things like your glucose level. So you shouldn't have glucose in your urine specimen. If you do, then that's a sign that you possibly have high levels of glucose in your bloodstream, and now it's spilling over into the kidneys and being passed through the bladder into your urine. So if a patient has glucose in their urine, it would key me into possibly that you might have gestational diabetes. The other item on the list that we look at is ketones. So patients sometimes pass ketones into their urine. Also, if they're diabetic, then some are deliberately doing it when they're on that ketoacidotic diet. So they're trying to lose weight, and this happens when you are metabolizing fat in your body, and it breaks down, and the fat molecules actually produce ketones in the urine. And also sometimes you can see this if someone is, basically starving. So we just worry, like if a patient comes in and she's severely dehydrated, it's possibly because she has severe nausea and vomiting in the beginning of a pregnancy, and then if we see ketones, we need to basically send her to the hospital maybe for IV hydration. Then there's specific gravity, and that tells us if the urine is too concentrated or it's too diluted. Normal specific gravity is between 1.002 and 1.035. We're looking also, as noted before, if there's blood in the urine. And if you do have blood in your urine, it could mean you have a urinary tract infection, or you could have some form of kidney disease or maybe a kidney stone. Normal pH is between 4.6 and 8, and an increase in your pH could also indicate a urinary tract infection if the patient's been having severe dehydration from vomiting or kidney failure. If it's too low, then that's an indication possibly of starvation, diarrhea, and diabetic ketoacidosis. Another very important indicator of a problem in pregnancy is if there's protein in the urine. and that can indicate something called pregnancy-induced hypertension, and it shows that the patient is having some type of metabolic reaction to high blood pressure during her pregnancy. And then most importantly is to see if someone has a urinary tract infection. So we're looking at nitrites and leukocytes. So if a patient has nitrites in their urine, that is an indicator that she most likely has a urinary tract infection. And if she has leukocytes, then it's either she didn't do her clean catch urine properly, and also it is an indicator of a urinary tract infection as well. And there it is. This is how you get the quote, "Your pee looks good," before you leave the office. And this is why a urine sample is so important for your overall health. And thank you again for watching my video, and please subscribe below, and I'll see you in future videos. Take care. Cheers.